My name is Mallory Lancaster, and I'm the practice manager here at Jade Integrated Health. And I'm sitting down with one of our acupuncturists, Elizabeth Arris, who works in our Portland location. So hi, Elizabeth.
Hi, Mallory.
How are you?
Good, thanks.
Good. Thanks for being here with me today. So as we kick off National Women's Health Week, why don't you tell me a little bit about yourself and why you enjoy treating women's health?
Sure. So I've been an acupuncturist for about 5 years, treating mostly women, but also male patients as well. And one of the things that I really enjoy about treating women's health is that the way I see it, when I work with one patient, I'm actually benefiting her family and her community. And the reason is a woman who is feeling healthy and pain-free is going to be more productive at work. She's going to be happier at home and with her family, and she's going to be more likely to maximize her full potential as a human being. So I enjoy treating women's health issues because I think it's a way where I can actually help to reduce health disparities just in these small one-on-one interactions.
So being somebody that has maybe never tried acupuncture before, what are some some symptoms and diagnoses that acupuncture can treat specific to a woman's body?
So anything related to a woman's reproductive health can be improved with acupuncture. Dysmenorrhea is something that I see a lot, endometriosis, PCOS, also pregnancy and perimenopausal symptoms can be improved with acupuncture. But apart from the female reproductive system, there are a lot of other conditions that acupuncture can be beneficial towards that affect women more than men. And those we don't necessarily think of as women's issues, but for example, chronic pain affects more women than men. Migraines affect way more women than men. So there are some other things like that too that acupuncture can be very helpful with.
That's really interesting. I didn't know that women were affected by more of those things.
Yes, autoimmune disorders are another one where it's far more women experience and suffer from autoimmune disorders than men. And incidentally, acupuncture can be very helpful for all of those things.
Right. So you mentioned earlier that acupuncture can be really helpful for a woman's reproductive system. And it seems like more than ever that acupuncture and fertility is something that's being more talked about. Why do you feel that acupuncture should be a part of the process when it comes to a woman deciding whether she wants to start a family or even just build her family?
So acupuncture can help along the process in a few different ways. It can help to regulate the menstrual cycle. So if a person is just thinking about maybe becoming pregnant, but she has irregular cycles, then acupuncture can be something that helps her to get from that stage to the next stage. Some of my fertility patients aren't really there. They maybe have tried to get pregnant naturally and have decided to take the next step, and that's one of the things that we hear about for acupuncture with fertility a lot. So acupuncture can help with all these different stages of assisted reproductive technologies. It can enhance the effects of things like IVF. It can increase levels like progesterone and AMH and lower cortisol. And so depending on where a person is, there is a use for acupuncture at each different stage of the fertility process. And if all the efforts are successful and a woman becomes pregnant, then acupuncture can also help with symptoms during pregnancy and postpartum recovery.
What women's health issue do you wish that people were more informed about?
Stress.
Yes.
I think that stress makes almost every issue worse. And so many of my patients, male and female, but especially my female patients, have challenges that are worsened by stress. It could be chronic headaches, it could be insomnia, it could be musculoskeletal pain or digestive or reproductive issues. I don't know if I would even have a job if most of my patients actually just tried to lower their stress levels during the course of their day. So I am always encouraging my patients to try and do less, to try and delegate more, to try and stress less, and to try and prioritize self-care.
Great. Well, thank you so much, Elizabeth, for being here with me today.
Thank you, yes.
And if you guys want any more information regarding Elizabeth, or if you want to view some more interviews, you can log on to www.jadeintegratedhealth.com.